My name is Tracy Bivens-Davis, and I'm the chair of the Los Angeles Women's Collaborative on HIV. Our mission is to empower women in their sexual health to end sexually transmitted infections through education and research. This year we renewed our vision to reflect the desire for women in our county to have access to quality and culturally competent sexual reproductive education, advocacy, and services. Together with my friends, #BGSD, who are at the table, manning the tables, hey, or my personal group of Girl Warriors, who you'll see coming to your tables throughout this morning and throughout today. We have been able to really gather you all here to share information, education, and put a spotlight on women and their sexual partners. Now, this many years into the pandemic of HIV, and the messages aren't new. Why are women becoming infected? The fact remains the same. The influences that increase HIV-related risk factors for women are the need to have children, limited economic resources, the prevalence of sexual and physical violence, partner trust, inadequate knowledge of human sexuality, and don't forget sexism. The need to live, love, have intimacy, and create family. So women are particularly vulnerable in spaces that we perceive to be safe, or within relationships where the power dynamics are just difficult to make negotiation impossible. So today we shift everyone's attention. We understand that men are drivers of an epidemic, but we as women need equity and access. As a community member, I need my doctor to give me more information that scratches beyond the surface of yes and no. Why? Because we in Los Angeles have a problem. Here in LA County, between 2007 and 2011, the rate of HIV diagnosis amongst African American females increased by 15% from 2011 to 2012. In 2014, women made up 19% of new HIV cases in the nation, and 87% is attributed to heterosexual sex. African American women and Latino women are most highly and disproportionately impacted. And while the nation overall is experiencing a decrease, Los Angeles has yet to catch up. There's clearly work to be done. Today we shine the light on the need for increased access to prevention for women and their sexual partners. And we hope that by hearing this vital information, you'll work to increase access to a range of prevention methods, including educating your peers and other clinicians who work with women of all ages. We're confident that the expertise of our presenters will inspire you to think about how you can have a marked impact on preventing HIV and supporting healthy intimacy. And most importantly, we hope that you recognize the truth and words of Michelle Obama, who acknowledged communities and countries and ultimately the world are only as strong as the health of our women. So before I leave, I want to remind you today that it would not be possible if it were not for help from our friends. We are thankful to our sponsors and allies, the Department of HIV and STD programs and Walgreens. And we strongly encourage you to build relationships with Kelly from the Female Health Company. Hey, Kelly. Okay. On behalf of the Women's Collaborative, as well as the Los Angeles Women's PrEP Network, I want to welcome you all this morning. I am enthused and excited by your presence, and I hope you're looking forward to learning from our presenters just as I am. So without taking over your time, I want to introduce you to one of my girl warriors, Ms. Faith Lanza.
Everybody, I'm so glad to see you all here. This is wonderful. So pre-exposure prophylaxis has been approved by the FDA since July of 2012. And about 1,800 people in the city of Los Angeles are getting infected with HIV every year. Don't tell me for 1 minute that some of those people could not have used PrEP as a tool to keep them uninfected. Today is about telling more people about PrEP, about pre-exposure prophylaxis, what it can do as a tool to help women stay uninfected. I hope you will go home today, as Tracy said, and tell your friends and tell your colleagues more about how pre-exposure prophylaxis can help keep women uninfected. The first speaker we have today is Jenna Alarcon. Jenna graduated with a bachelor's in science from California State University of Dominguez Hills in community health science. After her graduation, she worked at the Los Angeles Biomedical Research Institute in the Division of Infectious Disease as a study coordinator, and over the last summer, she had an internship at Children's Hospital where she worked in the HIV prevention program under Miguel Martinez, working with the PEP and PrEP County Working Group. Jenna is currently in her second year at the University of UCLA, where I am, and in their Masters of Public Health program with a focus on community health science, and she will be graduating in June of 2017. Jenna will be presenting today on some of her findings over the summer. Jenna Alarcon.
Thanks for having me here to speak to you. So one of my projects over the summer was to figure out where NPEP services are located in the emergency rooms in Los Angeles County. Sorry, you couldn't hear me. So what is NPEP? NPEP stands for non-employee post-exposure prophylaxis to HIV, and it's a series of antiretroviral medications that are given after exposure to prevent becoming infected with HIV. This medication must be given within 72 hours of recent exposure and must be taken either once or twice a day, depending on the medication given, for 28 days. So the purpose of this was to identify NPEP where it's offered in local emergency rooms for individuals who are seeking NPEP after normal business hours or do not have a primary care provider. The assessment was undertaken over this past summer in August and is based on conversations that were in the Los Angeles PrEP and PEP work group. So this process of doing this project was built on a previous survey that was conducted by UCLA in 2007, and a 9-item questionnaire was developed, and I took that list of questions to, we came up with about 20 some odd hospitals just to visit out in the greater Los Angeles area according to where in the community, spread out enough so people who can access at different areas. I visited each site and identified people. I asked charge nurses, nurse practitioners, doctors, these questions just to see what answers I would get for them. Surprisingly, some of the comments that I got were quite shocking. Do you look it up on the internet? And I was like, well, yes, I can, but if I'm a patient coming in, are you really going to tell me, go look it up on the internet? I wouldn't recommend this medication. It's too dangerous. And I really would like to say, I wasn't asking for your opinion, but I didn't. I just sat there and said, okay, well, I just want to know if you offer this at your emergency room. Then I got from another hospital, that's a good question, I don't know. And this scares me because we're going here to providers to get these resources, and if they don't know, how are we supposed to get these medications? Some positive comments that I got were at some county hospitals, they told me, well, if patients don't have insurance, they'll be signed up for a 30-day temporary Medi-Cal, which I thought was awesome. That'll help them cover the visits of the doctors and cover the medications that were needed for those 30 days. And I've also got some positive, yes, we offer PrEP. And they told me, I had a doctor sit there with me and tell me the different medications that were given. Also, I believe the reason why he sat there with me is because I had a relationship with this doctor. He's a family friend. I went to that hospital prior to, the day before, and I spoke to a charge nurse and asked about PEP services. And he said, oh yeah, we have PEP for employees. And I said, no, I'm not talking about employees, I'm talking about patients that come into your ER. And he said, well, I don't know. So going home, I talked to my brother and was like, wow, this hospital is kind of, different. And he said, well, why don't you talk to this doctor and, our doctor friend. And he said, okay, I'll come in and talk to you. So he sat there with me, went through, and this hospital actually has a PEP order. And this order at this hospital includes the different tests that need to be ran and the different medications provided. So I thought that was awesome that they actually have a PEP order in their system. So my overall summaries were that a majority of the staff that I encountered did not know what NPEP was. And I never said NPEP after about the first hospital. I had to say non-employee post-HIV exposure prophylaxis. And then it kind of clicked to some people. A number of nurses shared their concerns about prescribing the medication based on personal opinions. Several emergency rooms indicated that patients who don't have insurance would be signed up for temporary Medi-Cal, which I think is awesome. And a majority of their staff visited were not aware about their hospital protocols when administering PrEP. So out of the 17 hospitals that I visited, I would only probably recommend 6, which is a shocking number to me. So the point of this project is to just become aware of what resources we have, and hopefully we can get into these hospitals and make a difference and make these medications available. Thank you. Yes.
What are the 6 hospitals